Okay, so now that we've talked about how to get pregnant, let's talk about some of the issues that may come about when trying to get pregnant or infertility. So infertility and subfertility are common. Subfertility meaning having a difficult time getting pregnant, however, not having an impossible time. Infertility means you are not able to get pregnant. Approximately 15% of couples seek medical help in establishing a pregnancy. So around 15% of couples have trouble in some way, shape, or form with getting pregnant. Now, there used to be this common thought that women had more infertility problems than men, and that's actually not true. It's just as likely to be the man as it is to be the woman. So for men, things like low sperm count are an issue. This can come from undescended testes. If there's any sex chromosome abnormalities, that would become an issue. Infections that can come from STDs, chemotherapy, heating of testes, and many times this happens from laptops. Too tight clothing. So back when I was younger, they would talk about cowboys and how cowboys would have trouble because sometimes their pants would be too tight and therefore the testicles couldn't move away from the body when they got hot. So remember, I believe talking about this, testicles have the ability to move closer or further away from the body, and they do this in order to regulate temperature. And so if the pants are too tight, then the testicles aren't able to move away from the body when they're hot. The new thing that's going on is these skinny jeans actually sometimes have too tight of clothing, and for a while the fad was for men to wear women's pants to get those skinny jean looks, and the pants were just too tight in the testicle area. Another thing that can be an issue is strenuous exercise, and then of course toxins of all different kinds can lead to low sperm counts. So these are the common issues that happen with men. For women, it can be abnormalities in the reproductive tract, meaning something's going on in any part of the reproductive system, whether it's the ovary, the fallopian tubes, the uterus, etc. A failure to ovulate, of course. Sometimes women don't ovulate every month, or they ovulate every other month, or they'll just have issues knowing when they're ovulating. So, of course, that would be an issue, and that could contribute to infertility. And then, of course, age tends to decline fertility in both men and women, although for women, of course, it's more drastic, especially because women have menopause, and after menopause, again, virtually impossible to get pregnant. So here's an example of specifically women. So these are women who wanted to get pregnant and still remain childless after the fact. So 15 to 19-year-olds, if they wanted to get pregnant, and hopefully there's not a massive amount of women in this age range, or really children if you're talking 15, if they wanted to get pregnant, maybe less than 10% were not able to get pregnant. So they still had fertility issues, but very few. As you climb up in the age range, for example, 35 to 39, all of a sudden 30% of women who wanted to get pregnant in that age range were not able to. And when you get to the 40s, 40 to 44, 61% of women who were wanting to get pregnant were unable to. So as you see, age is a real issue. And I believe that this graph is specifically after 1 year of trying, but I could be wrong. Okay, here's an example of an abnormality in sperm. So this is a sperm, as you can probably tell, that's the head, but you can see this sperm has 3 tails. So obviously it's not going to be going anywhere, right? It's not able to propel. And so if a sperm is unable to propel, then it's not able to reach the egg. And so here's an example of an abnormal sperm. And if a man has a lot of abnormal sperm, then he would have trouble getting the woman pregnant because his sperm wouldn't be able to reach the ovary, or I'm sorry, the ovum, the egg. Okay, so there are many ways in which that you can treat people who have subfertility, or with fertility treatments. So the first one I'll talk about is artificial insemination. So this is actually where you place the semen into a woman's vagina or oviduct to help increase chances of pregnancy. So this is a fairly simple task in which they take the sperm, and maybe if the sperm has trouble swimming upstream, then you can put it much closer to the egg. Next is in vitro fertilization. This is when the egg is fertilized by the sperm outside of the body and then it's implanted after. So this is if, again, the sperm has a really difficult time reaching the egg, then they will take out, they will take out the ovum and they will fertilize it outside of the body and then place it back in. Most of you have probably heard of Octomom. She had in vitro fertilization. So many times, because this is a very expensive procedure to do, I believe it's in, tens of thousands of dollars, many times they will take out multiple eggs and inseminate all of them or fertilize all of them and then put them all back in the woman. And most of the time, not all of the eggs are going to successfully implant. Therefore, she'll only be left with one, maybe two, at highest maybe three fertilized eggs that stay in her uterus. So with the Octomom, what happened is they put in, first of all, an abnormally high amount, because they had to have put a minimum of 8 eggs inside of her. They put an abnormally high amount, but what was bizarre is they all implanted, which is rare. And so this is why she had 8 children, is because the in vitro fertilization was almost too successful. They all implanted, which is rare. And she also just had too many eggs inside of her. But that's an example of in vitro fertilization. For the most part, that's not the case at all. Maybe one or maybe none at all will catch. Okay. Next is gamete donation. These are sperm or oocytes. Of course, this is when a male or a female just donate to clinics or whatnot, and those can be used later. Second to last is, of course, administration of drugs to stimulate ovulation. So if any woman has trouble ovulating or she ovulates less frequently, then they will give drugs that will facilitate ovulation and drop more eggs, or at least an egg, so that she has a chance of getting pregnant. So that's another option for women. And then, of course, you can have a gestational surrogate to carry a pregnancy. Now this, just like the gamete donation, doesn't have to be because you have infertility problems. Using a surrogate does not have to mean that you have infertility problems. However, you can use it. So, for example, if your uterine wall, say, is very hostile or it doesn't hold eggs very well, then you can actually get a surrogate to plant an egg, a fertilized egg. So you would do something like in vitro fertilization. So you would take your egg, or the woman's egg and the man's sperm, you would fertilize it and then put it inside of your surrogate. That's one option. Other people decide to use the egg of the surrogate or whatnot, depending on your choice. But a gestational surrogate is a person who carries your child to full term. Okay, and then lastly, of course, adoption is an option for anybody who has issues with fertility. The hard part is that preferred adoptees, meaning infants and of a specific race or ethnicity, is actually very limited. So people always talk about adoption, but actually it's very difficult to adopt certain types of children here in the U.S. And so if you want a child that is, an infant and specific certain races, then it becomes an issue to get that child. Now, if you want an older child or a child with some sort of disability, then there's a lot of options out there. But unfortunately, not a lot of people want those type of children. They would rather a healthy young child who's within their own race. Okay, here's an example of the in vitro fertilization. So if you see, what they're doing is they're taking these oocytes out of the fallopian tube, so they don't have it even drop. They actually pick it up from here, and they use ultrasounds to see how to get to it. And they stick it in a test tube, right? And then they get the sperm from the man, and they have it in a test tube, and they put the oocytes and the sperm together and watch them get fertilized. So they know these eggs are fertilized. And then they take this device that holds them and put it into the uterus, and then they release it, hoping that these oocytes, or these now fertilized eggs, will attach to the uterus. And again, if it doesn't, many times it doesn't, attach all three or as many as you put in, but every once in a while this is how you can get multiple pregnancies, is if more than one of these fertilized eggs attached to the wall. Okay, a large percentage of embryos actually do not survive. So they either fail to implant onto the uterus, as we talked about with in vitro fertilization, but in general, an egg might be fertilized by sperm, but it just never implants into the woman, or it's spontaneously aborted. And I want to explain what aborted means here, because most people think aborted or abortion has to be elective, meaning that it's the kind where you go into the hospital and we'll talk more about abortions later, but that it's medically aborted. A spontaneous abortion is more commonly called a miscarriage. It just means that it's terminated, right? And this is not done by anything that the woman has done. There's no medical reasons for this. It's spontaneous. So a spontaneous abortion is also called a miscarriage. And again, this is relatively common. So specifically, it's the most common in the first trimester, which is the first 3 months of pregnancy. This is partly why you'll hear most women, or maybe if you haven't talked to a lot of pregnant women, but a lot of pregnant women hold reservation in telling their families or, being as vocal about their pregnancy until the first trimester is passed. And this is partly why, because a lot of embryos do not survive the first trimester. Believe it or not, sometimes a woman doesn't even know that she's miscarried, and that's because it's so short in the fertilization process that she might not even notice. So for example, she might skip a period, or she'll have a delayed period, or possibly no delay at all, but all of a sudden she'll menstruate, and she'll have no idea that there was something going on because it was such a short-lived pregnancy. So it could have been just a week or a few days that this, that the egg was even fertilized. And if it didn't implant, it's even questionable if that was even considered a pregnancy, because it's just 2 eggs at this point, or 2 cells at this point. Another issue could be what's called an ectopic pregnancy. And this is a really scary issue, really, because this is when the fetus or embryo implants at a location other than the uterus. And this is a real issue specifically for maternal mortality, and more so in the first trimester. So the leading cause of maternal mortality in the first trimester is actually ectopic pregnancies. Just the first trimester, though. So later, it's many other issues that can lead to the mother's mortality. But in the first trimester, typically, it's relatively safe, except for ectopic pregnancies. Another issue is it can lead to tubal rupture. So most of the time, these ectopic pregnancies tend to the fertilized egg and sperm tend to attach to the fallopian tubes. And so as it gets bigger, I have a picture of this, as this single cell organism gets bigger and turns into an embryo or a fetus, it's too big for this small area, right? And so what's likely to happen, you might have guessed, is it's going to rupture, meaning that it's actually going to break the fallopian tube. And this is why it's so dangerous, is then the woman can bleed out. But also, now you have a real issue with her getting pregnant later because she doesn't have a tube for the egg to go through. So there's a lot of issues going on here. It's very rare. It happens about 1% of all pregnancies. But when it does happen, it's very serious and it can endanger the woman's life. This is why it's really important to get those ultrasounds, is because they can check immediately if the egg has implanted in the right place.